it's time for another lecture by Professor Kuldeep K. Pandey, Head and IC Ayurvedic Palliative Care Unity, Department of Sangyaharan, Faculty of Ayurveda, Institute of Medical Science, BHU, Varanasi. The topic will be Cancer, Control, Cure, Care, Challenges and Perspective of Ayurveda.
So, very good afternoon to all of you. Dear friends, we all know that the era is alarming us to control the cancer developing and spreading. It has a lot of challenges in spite of many modalities of the control as well as the care and cure. So we are taking a big challenge from that enemy, which is going to spoil whole of the society, whole of the humanity, and entire global problem is increasing accordingly. So I will be focused only on that. So my motive is just to create a friendship relation with the ancient wisdom of knowledge of medical science, that is Ayurveda. It is right. Dear friends, we all know the characteristic features of development of the cancer: transformation, dysregulation, toxicity, invasion, and angiogenesis and others. These are the characteristic features led by the scientific team of the medical science, but that has been very much clearly mentioned in ancient Indian medical science, that is the Vedas and the Ayurveda. The symbol of the cancer that has been mentioned as a logo of the cancer is Karkat, and it has been mentioned in Rigveda. From that reference, this has been taken, and the Karka or the Karkata Arabud is been nomenclated, yeah. So, when all of a sudden there is a flood, many of the rescue teams goes to control the ill effects of the flood. We can't prevent the challenging factors of developing cancer now these days. Age is another factor, our lifestyle is another factor, and the entire environmental changes are another. But the government has decided how to control cancer. So they made a policy, they made a team to make an awareness and educate cancer causing factors, but still it is not in the control. So every 9 out of 10 cancer peoples are plus 45. The very productive, we present data. We are discussing data of many types of the cancer control, care, and the treatment modalities. But we don't think the productive age is 45, and out of 10 cancer are 9. So can you imagine the productivity of the nation or the globe is being affected? Can't we prevent, can't we take the challenge as a prevention? And 28% of 0 to 74 years. Meaning that a person who is just born and attains its age of 74 years, of those population, that population, 28% will develop a new cancer. This is only because of the many more factors, and lifestyle is one of them. Over 14.13 lakh new cancer cases are developing per year. So this is an alarm, not just a data. These data are just to alarm us. Please control, care, and other things. These are the burdens. 68 people, a male, and one is suffering from the cancer, lung cancer, and 1 in 29 breast cancers, and 1 in 9 Indians will develop the cancer. And out of those, breast cancer, cervical cancer, and old cancers are more common. And 8 lakhs per year are developing new cancer. These data are not just to present and to make aware to you. It is just to think over why it is. Can't we prevent? Can't we cure or control as we can? And out of that, the pathetic condition becomes when 69% of those cancer patients, they commit suicide. Think how horrible picture of that family becomes when a patient feels a painful death living with the cancer, that is the 57%. And those patients, they ask, oh, cancer pain or the god of pain, I'm your daily customer. Please give me a little bit discount of pain. It is not possible. But the picture becomes more pathetic. So we have to think that one. No doubt we are having a lot of challenges. पेशेंट क्या करते हैं? किसी को छोटा सा कैंसर का फीलिंग हुआ, करेक्टरिस्टिक फीचर कहीं वूंड दिखा, ग्रोथ दिखी, वो नीम हकीम के पास पहले जाएगा, फिर हेल्थ सेंटर जाएगा, फिर 10 जगह एडवर्टीजमेंट में दिखेगा कि फला जगह कैंसर का अच्छा इलाज होता है, दूर दूर जाएगा, दवाई लाएगा, खाएगा, फ्री में लाइन में लगेगा. लेकिन वो पेशेंट जब किसी अच्छे सेंटर पे जाता है या फिजिशियंस कैंसर के स्पेशलिस्ट पे जाता है, तो हमारा वो कैंसर कन्वेंशनल थेरेपी पहली चीज़ तो रिस्पॉन्ड नहीं करेगी, और दूसरी चीज़ उसके इल इफेक्ट इतने ज़्यादा होंगे क्योंकि वो जो टेस्टेड ड्रग है वो मल्टीपल थेरेपीज़ के ट्रायल पेशेंट पे नहीं है. दिस इज़ द बेसिक प्रॉब्लम. Why the current cancer conventional therapies are not being effective. This is the problem. Second, because of the ill effects of those and the continuous persisting cancer disease itself, it causes a lot of changes inside the body, and the poor quality life it becomes stained. Then मरीज बिक जाता है, सोशियो इकोनॉमिकल स्टेटस उसका बिल्कुल डाउन हो जाता है. कल अभी रथ साहब बोल रहे थे कि वी हैव टू थिंक ऑल ओवर द पिक्चर ऑफ ए पेशेंट. परसों कल किसी ने मेरे से पूछा, सर व्हाट इज योर डेटा, हाउ मेनी पेशेंट यू आर ट्रीटिंग देयर. आई सेड one patient is my 100% data, and if I can improve the many quality of life of the patient, means the data is according to that. And if I lose that very patient, there is 100% loss of that data, because the family loses 100% of that family member. So we have to think over. Ultimately होता क्या, अभी योग के साइंस के लोग बोल रहे थे कि योगा से हम क्वालिटी लाइफ बनाएंगे, योगा से हम उसको कॉग्निशन फैक्टर बनाएंगे, योगा से हम उसको कार्डियक फंक्शन ठीक करेंगे. लेकिन होता क्या है, जब पेशेंट ये सारे प्रॉब्लम्स बियर करता है, व्हेन द ड्रग इज नॉट रिस्पॉन्डिंग, पुअर क्वालिटी लाइफ, पुअर सोशियो इकोनॉमिक स्टेटस, एंड देन व्हाट हैपेंस, पेशेंट भगवान में विश्वास छोड़ देता है, डिप्रेशन में चला जाता है, और द पेशेंट सेज मेरे घर के बगल का पड़ोसी बहुत पाप करता है, उसको कुछ नहीं होता, और सारा कुछ मुझे क्यों हो रहा है. एंड दैट अकाउंट्स फॉर द quality life improvement. Ayurveda stands here. When the patient comes, we count 4-5 pictures as we have made a questionnaire for the correct data. But can you imagine a large number of the ill effects or the biggest stories are inside the body? एक पेशेंट को लिप में कैंसर हुआ है, कैन यू इमेजिन व्हाट द डैमेज इनसाइड द बॉडी इज? Many more factors, many more systems, many more cells. Not the periphery of the or the surrounding tissues where the metastasis has been taken place. But it affects the entire system according to principles of Ayurveda. The inside story is very big and that is hidden and to be explored. So these are the certain challenges which we have discussed a lot. I'm not going into detail, but has been discussed by many speakers earlier. The very big question and the challenge arises when a patient comes to you, being a physician, and he has been told, my dear friend, you are having a possibility of a cancer-like symptom. And the very moment, patient is shocked. Can you imagine what the effects of the shock at that very moment to the person suffering from and to the family member? Not the only one person, entire family, friend and relatives are being suffered when a person is being diagnosed, and that leads a lot of ill effects. Then there are many more barriers. I will not go into detail because it had been discussed. Then, as Dr. Tarang said, that we are not talking about the complete cure, but we can care and we can improve the quality life. So Ayurveda stands here. We are trying. So what Ayurveda defines a cancer? Cancer is not a disease. It is a tendency to create a disease-like structure or the characteristic features of gulma or growth. The tendency, we have to prevent the tendency to develop a cancer-like disease. It is a symptom. So for that, we have to follow the principles. It is very difficult to explain within 2 minutes that what are the principles of Ayurveda to treat a cancer is. That is the entire body is made up of dosha, dusha, dhatu, mala and the bal and ojas. I'm happy to say that the last very component, Bal and Ojas, has been included in the armamentarium of the cancer therapy unit, that is the immunotherapy. Earlier it was said the surgery, chemo, then radiation. Now they are including this Ojas or immune therapy. So these are the factors which are to be understood well, and the factors, doshas, doshas means the 3 body humors. You might be knowing that the vata, pitta and kapha, these are the 3 body humors. And when the vata proliferates massively in an dysregulated manner, the proliferation of the cell takes place and developing the cancer-like structure. And that has been said in the Sankhya Darshan, Eko Aham Bahusyama, means there is only one and it desires to be multiplied many more in likes or other more than that. So in text of Ayurveda, the genesis of the cancer is like there is a edema nomenclated at the sofa, then a glandular structure is the granthi, then tumor, that is the arbud, then metastasis from one side, and the distance is the durarbud, and the vidradhi, and the abscess or the non-healing ulcer. These are the terminologies mentioned in the text of Ayurveda. We have to correlate accordingly what and how it happens. It has been mentioned regarding the cure and care of the, as why the osteosarcomas are very difficult to treat, because according to Ayurveda, the 7 dhatus are the building materials: rasa, rakta, mansa, meda, asti, majja and sukha. The deeper one is affected late, and it is being very difficult to cure or care that one. So This is the principle where it has been mentioned. So what are the principles? On which principles we Ayurvedic physicians treat the cancer? That the Prakriti Vighat. It is very difficult to control the causative factors because our lifestyle is materialistic and we want to honor more and more by hook or crook. The lifestyle is changed with the our job and profession, so it is very difficult to change that one. We are bound to take the junk foods, we are bound to take the packed foods and other things. So it is very difficult. So Prakriti Vighat, but we can check aware. One of the participant asked Dr. Rath that why the female patient or female girl, they are not being provided the vaccination. Modi will not do. We have to do. So, Prakriti Vighat and then Dhatvagni Deepana and Pachan. I have gone through the many literatures and found that in mitochondrial level there is a change in the chromosomes and others, that is the Dhatvagni. And then detoxification. Whatsoever is being neutralized by any therapeutic agents must be eliminated from the body. That is the Shroto Shodhan, according to Ayurveda. Then maintain the equilibrium maintain the balance of the cell metabolism and other things. Prevent the further progression you have to do and improve the psychological physical component. Yogic paper presenters, they have correlated very well how the brain and the heart and the physics is being made in a balanced state. That has been good. And they provide good analgesia and many more drugs, having the anti-cancer drugs and improve the quality life. So what the principles of Ayurveda is spiritual therapy, then psychotherapy, and drug and diet-based therapy. This is the tri-dimensional module of the Ayurveda to treat the cancer patients. I don't force you that you please, and never I say that I can cure the complete cancer, but please come and join Faith in Ayurveda as an adjuvant. I have worked a lot with the Department of RT and RM, Professor U.P. Sai at Institute of Medical Sciences, Varanasi since 2007 to 21. And we had a lot of work in collaboration with the drugs having the Ayurvedic properties, and we have found that to minimize the untoward effects, minimize and cure the symptomatic disorders, correct the metabolic symptoms, and improve the psychophysical imbalance and improve the immunity. So these are the factors where we had worked a lot because of this and application of many more drugs. We are discussing since 2 days, and many more papers have been said that these are the certain drugs. I have worked on these drugs and found very much and very good, effective for the management of the cancer and other things. Then these are the drugs which and on which principles we are using. And one thing I would like to focus over here, that is the diet regime. It is not like that you have to take. I used to prescribe my patient, कुछ नहीं खा पा रहे हो सत्तू का घोल लो, कुछ नहीं खा पा रहे हो सूप लो, कुछ नहीं खा पा रहे हो तो रसायन लो और उसको दूध में मिक्स करके लो. You will find a drastic change in the patients. What happens? There is a decrease in immunity, not only because of the cancer cell toxicity, because of the many more factors, psychofactors, physical factors, and the drug itself, and the progression of the disease. You may find a lot of changes which decreases the immunity, and then metabolic function, it also decreases. Then what happens? A lot more systemic disorders they develop. Chemotherapeutic drugs are not just to just to stimulate the emesis. Emesis is because of the factor inside the body of the patient which can control the emesis, but it is deformed. It is not functioning. So this is only because our immunity to control the emesis is damaged. Otherwise, there is no harm. Then application of aroma. I am I'm not finding here that the person who told that aroma can be a good answer of non-invasive pain control, mood elevator, and enhances the many body functions in a normal state. अच्छा, आप बोलो कि घर में जाते हो पूजा करके, पूजा घर में अगरबत्ती जलाते हो, कितना अच्छा लगता है। पार्टी पिकनिक में जाते हो, थोड़ा सा फूस-फूस लगाते हो, मूड एलिवेट हो जाता है, एकदम चीयरफुल लगते हो। और मैंने अपने पेशेंट्स में देखे, सर, वी हैव डन अ लॉट ऑफ वर्क ऑन द लेबर पेन एंड आई यूज दिस एरोमेटिक drug and found the control in the aromas. एक छोटा सा मिथ है सर। सीता जी को अशोक वाटिका में रखा गया, अशोक के पेड़ के नीचे। कृष्ण और गोपिका जब जाते थे जमुना के किनारे, कदम्ब के नीचे रहते थे। Both the plants have CNS depressant, anti-stress aromatic factors. So we have to learn from the myths in our text of ancient wisdom. So these are the characteristic features of aroma that might be a good field to control pain, depression, and to improve the quality of life, which is non-invasive in nature, and any patient can take in terminal stage. So pain our life. हम सारे लोग यहाँ कितने पेन लेके आए हैं? हम सारे लोग पूरी वर्ल्ड में एक न्यूक्लियस पेन है, उसके चारों तरफ मनी है, मशीन है, मैन पावर है, मेडिसिन से घूम रहे हैं, और उस घूमने में पेन मुस्कुरा रहा है अंदर, और हम पेन में हैं. दिस इज द मिस्ट्री एंड वी हैव टू फाइंड द आंसर. आई एम थैंकफुल टू दिस वेरी ओल्ड ट्रक. मैं काशी का रहने वाला हूँ. काशी में भगवान शंकर है, भांग उनका प्रिय है, भंगा. विजया, विजया क्यों? उन्होंने दुश्मनों पे विष पे विजय पाया था, इसलिए विजया है. और कीमोथेरेपेटिक ड्रग जो है वो कैंसर के विष को मारता है, सो विजया है. सो दिस विजया cannabis product I used first in post-operative surgical pain and found a good result with a good hemodynamic status of the patients. Studies going on, so that I am not going to present. But अगर आज मॉर्निंग में ऑपरेशन हुआ है और मैंने पेशेंट को पर रेक्टल लगा दिया है, तो अगले दिन दोपहर तक मरीज को दर्द नहीं हुआ. This is the observation of the cannabis suppository. And equally, I am thankful to the Onco-genomics manufacturers. They have provided me the free sample, and our ethical committee of the Institute of Medical Sciences approved that one. This is the CA esophagus case of 2017 after CA esophagus and having the post-chemo and post-radiation esophageal atresia. She was unable to take a sip of water even though. Hardly she could take 1 cup of water or milk in a day. And now she is quite happy with the hybrid herbal drugs, decoction of 4-5 drugs along with the cannabis product. You can see these patients. I am using the cannabis full extract on the tongue with a cow ghee. 2 to 4 drops of the cannabis extract, full extract with the cow ghee, and you can see the result in those patients. They are under my study still on. She is a sister of one of the Padma Shri Awardee and having the NHL, and was paralyzed below umbilicus and was unable and hopeless. And the patient was brought to my OPD on stretcher, and they said, "Jate jate sir, tulsi dal de dijiye aap." I'm happy to say that she is still alive and with a normal life. There is no problem. She had only 2 courses of the chemotherapy, and after that she had developed a lot of problems after surgery and chemo. But now she is like us. She is a good attendant of her homeopathic doctor husband. This the case of squamous carcinoma, and I have given only herbal drug decoction and the curcumin along with the other herbal drug preparations which was effective in that patient, and you can see the result. This is a case of CHN developed, and cannabidiol, which extract was used locally to the patient along with the extract and the one of the other species of the curcumin which I found from Calcutta, and that I'm using the extract, raw extract with milk to the patient and found that one. Now, the another aspect of treating a non-healing ulcer in a cancer patients which were hopeless. So it is being mentioned that if a cancer-like disease or non-healing ulcer is not being cured by the surgical procedure, medicine, then use alkali of the herbal drugs. And if it is not being treated or not cured, then use Agni Karma, like a cauterization of alloy of 5 metals, and that will not recur. It is mentioned in the text of Sushramita. So I perform a patient of corn, operated corn, developed the cancer, very poor patient. And then I started, this is the 4th sitting in my OPD, and you can see the result. In lower picture, you will find a patient of CA breast after chemo radiation, a large number of the, this scar is there, and then I used extract of marigold leaf over the scar and Agni Karma. You can find the result after chemo and radiation. This CA. This is another case where I performed Agni Karma, and after 4th sitting, the patient came to my OPD yesterday, but I was here, and tomorrow he will visit to me, and you can find the Agni Karma along with the cannabis extract or cannabis seed oil preparation. So Panchaval Kalkat, 4 Devavriksha, bark of those but Udumbar people pakad. The bark of those plants make a tea, wash the wound and give this oil locally. The result is in front of you, nothing else. They all were refused either by the patient to take the conventional therapy, or they were refused by the surgeon that your age and the physique is not aligned to you perform further. This is a case of, unfortunate case of laryngoplasty. Patient was subjected to laryngoplasty, and after that she developed cancer in the middle and external layer. After first sitting, you can find the regression of the growth in external layer, and I performed this Agni Karma along with the local application of the cannabis oil and cannabis seed oil. So these are few slides which I would like to share. So my dear friends, both the sciences have a good knowledge, good caring attitude, but in the words of teacher of my teacher, Professor K. Pandey, who was the stalwart and the pillar of the Institute of Medical Sciences, Department of Anesthesiology, he said, until we are not knowing each other, there might be some conflict. I have come to invite you. We don't have any conflict. We don't have any jealous. We are meant for the care of the suffering, to pacify the pain. So we have to add the life, not the days in a patient. So offensive and defensive strategy. You have an offensive strategy to cut and kill. We are there to support, to clean, to make it normal with the Ayurvedic principles. So we are very much with you, sir. So our approach of Ayurveda is preventive, supportive, and managing the systemic complications, nothing beyond that. So these are the areas where we can collaborate for the research, and more we can do with these drugs in the field of palliative care. So make an umbrella, not only amalgamate the expertise of Ayurveda and allopathy. I have my team members in my palliative care, aromatherapists, musicians, sociologists, psychologists, and many more I have. And the time to time, they used to visit my patients at hospice and providing hospice therapies, and the patients are enjoying well. And in hospital, we are treating the patient, but in homes, we are providing many of the patients of my registered section. They are on call and they are calling on the videos, and we provide the consultation free of cost to them. So someone asked me that which one is the best therapy for the human. I said care and love. Then anyone asked me if it is not working, then I said increase the dose. Just you find the result of your patient, because unless you are not having sympathy with the patient, you don't deserve to be a scholar of any pathy. So develop sympathy first, then you will be called as a pathy of any system. So with these words, I am thankful for your kind listening and providing me attention. Thank you, sir.